The biggest motivation for laser vision correction in our practice, and I'm sure it goes across the country, is the desire for independence from glasses and contact lenses. For the patient who is dependent upon, gets up in the morning and looks for their glasses and then goes to the bathroom and put their contact lenses and they're wearing contact lenses all day long, those are the patients who really want to have some freedom from that. Today, most any refractive error is a good candidate for laser vision correction. So for example, we can treat nearsightedness up to about 14 diopters, which is very strong. And we can treat farsightedness up to about 6 diopters, which is also very strong, and a lot of astigmatism. So there's very few patients who don't qualify for laser vision correction because their prescription is outside of the range where we can treat. Now there are some, but there's really very few. There are some implicit eye findings that are not good candidates for laser vision correction. People who have thin corneas or irregular corneas, people who have very dry eyes or have some other ocular pathology which would interfere with the successful outcome of laser vision correction are obviously not good candidates. But today, most anyone who is dependent upon glasses and contact lenses is going to be a good candidate with very few exceptions for laser vision correction. We evaluate patients during an initial consultation. In that initial consultation, we have them come in without wearing their contact lenses or glasses. The patients are given a thorough eye examination and also additional tests, including a wavefront analysis, looking at the wavefront of the eye, and a corneal topography, looking at the curvature of the cornea. Abnormalities in the corneal topography are a very common way where we disqualify a patient for surgery, because some abnormalities in the corneal topography indicate that the cornea is a weaker cornea or has some inherent disorder or disease, and that would not be a good candidate for laser vision correction. The patient is then given a careful refraction, and that refraction is compared to the wavefront technology. But in most cases, we're using the wavefront technology exclusively to treat the patient. So when we input the data into the laser, we're inputting directly that wavefront data into the laser rather than their refraction, which comes from a test which is very objectively poor test, where the doctor asks the patient which is better, 1 or 2. I don't know if you've ever had an eye exam, but the doctor asks the patient basically for the final analysis. We use much more sophisticated technology for that. On the day of surgery, the patients are here for about 2 hours. Most of that time is before surgery, where additional testing is done to make sure that they continue to be a good candidate. They're given some Valium to relax them. They're in the operating room for about 10 minutes. The surgery takes about 5 minutes to perform. It's a very quick procedure. Patients then go home. They're given instruction. They have some eye drops to take. Most patients are asked to go home and take a pain pill and take a nap that day. For about 3 to 4 hours after surgery, most patients will feel some discomfort, so it's a good time to rest if you can. We see the patients the very next day, but 99% of the patients who come in the next day are seen 20/20 and go back to work that day. So it's a very quick recovery due to the fact that this protective flap is created that protects the treated area.